Hello everyone, my name is Aakanksh Gurnani, and welcome to my YouTube channel Neuro Chat with AG. On this channel, I plan to cover topics that are closest to my heart and support the neurodiverse community. Topics related to neurodiversity, autism spectrum disorder, and more. On the channel, I will interview thought leaders, esteemed researchers, scientists, professors, doctors, and psychologists, seeking their views and updates on their latest work, research, etc. I will also chat with parents of neurodiverse kids and adults and talk about experiences of neurodiverse individuals. My guest today, Dr. Christine Wu Nordahl, is a distinguished researcher and professor known for her contributions to the field of neuroscience, particularly in relation to autism. Dr. Nordahl's clinical interests are aimed at understanding how the brain develops in neurodevelopmental disorders such as autism. She utilizes structural and functional MRI to study the developing brain. Dr. Nordahl's research program uses neuroimaging to study brain development in autism across the lifespan. She directs the UC Davis Mind Institute Autism Phenome Project, APP, and Girls with Autism, Imaging of Neurodevelopment, GAIN study, two interrelated longitudinal interdisciplinary studies aimed at identifying clinically meaningful subtypes of autism. She is particularly committed to evaluating the entire autism spectrum, including girls with autism and up to the entire range of autism severity and intellectual abilities. Dr. Nordahl's research is pivotal in advancing knowledge about the neurobiological basis of autism, ultimately contributing to improved diagnostic methods and interventions. Dr. Nordahl, welcome and thank you very much for the time today.
Thank you so much for having me.
Could you please talk about your background and what inspired you to pursue a career in neuroscience, particularly focusing on autism research?
Sure. Well, I'm really happy to be here and I'm excited to answer your questions. So my background, I guess I'll start with what drew me into studying the brain. And so I went into college as a neurobiology major because I was always interested in the brain and trying really with a focus on learning and memory. So how do we remember things? How do we learn things? And where I went, the major was called neurobiology and behavior. And so I was learning a lot about not only, cellular mechanisms of the brain and action potentials and things like that, but also I was studying animal behavior. So I was studying things like um, mating dances in birds and, honing mechanisms in honeybees and things like that. And it was sort of like these two worlds that seemed very distinct to me, but it brought it together in a very meaningful way of how, what in the brain impacts behavior directly. Um, but then I also, in my sophomore year, I was interested in the animal behavior component, but then I became much more interested in the human component as well. And so I decided to also take psychology classes, and that's where I started doing research, was in a psychology lab. And so sort of this neuroscience and psychology combination is what really fit well with me. So pursuing sort of clinical questions using a neuroscience background. And my graduate work was actually focused on neurodegeneration. So because I was interested in learning and memory, I did work in Alzheimer's and mild cognitive impairment, trying to focus on really, what was leading to those impairments in cognitive decline. But around the time that I was finishing, there was this place opening up at the Mind Institute or at UC Davis called the Mind Institute. And this was an interdisciplinary research center bringing together psychologists and physicians and neuroscientists and basic biologists, all with the focus of neurodevelopmental conditions like autism. And I thought that it was a really exciting opportunity to work at a place like that because when you work in academia and you're in your own little silo of neuroscience or a very specific thing, you're missing out on a lot of the picture. And so this interdisciplinary approach to studying a neurodevelopmental condition was really exciting to me. And that's really how I got into autism research. And then I met some individuals and families with autism and absolutely fell in love with it. And I've been here for 20 years.
Your journey is very inspiring. That's amazing. Could you share a memorable or impactful experience from your research career that has influenced your approach to studying autism?
Yeah. So let me tell you a little bit about the Autism Phenome Project, which is the study that I now direct. But when I came here, the Autism Phenome Project was just getting started by the founding research director of the Mind Institute, David Amaral, and he was also my postdoc mentor. And at the time, so this was back in about 2005, there were many imaging studies, so trying to study the brain and autism, but most of those studies focused on older individuals and individuals with higher cognitive abilities, basically individuals that you could say, go lie down in an MRI scanner and let us take a picture of your brain. And so that's really challenging to do in very young children or people with higher support needs. But we saw autism, David saw autism as it is a neurodevelopmental condition. And so if you're studying the brain in an autistic person when they're 12 years old, you're missing out on the whole decade, or really more than a decade of life that's happened to them, because autism is often diagnosed early in childhood, so around 2 to 3 years of age. So David's vision was to start this Autism Phenome Project and start enrolling kids very, very young at the time of diagnosis so that we could look at their brains when they were being diagnosed with autism and not after 10 or 12 years of life and interventions and all of these things. So really to try to understand that neural basis of autism. And just quickly, I'll wrap up. And the other thing that the Autism Phenome Project was founded on was this notion that autism is incredibly heterogeneous. So there's many, many different co-occurring medical and psychiatric conditions like anxiety and gastrointestinal issues and epilepsy, but they don't happen in all people with autism. And so the goal of the Autism Phenome Project is to try to sort of separate out autism into different subgroups or subtypes, and then within each subtype, look at the neurobiology, the etiology, and then target interventions specifically for that subgroup. So for example, if a child does not have gastrointestinal symptoms, you don't want to target an intervention at them. But if you're having a clinical trial for gastrointestinal symptoms in autism, you may have people that wouldn't benefit from that. So identifying specific subtypes of people that might benefit from certain interventions is the whole goal of the Autism Phenome Project. So let me get back to your question about the particularly memorable or impactful experience from my career. So when I first came here, I had had a lot of experience doing MRI scans, which I'll talk about later, in older people, and because I told you I had been studying neurodegeneration and mild cognitive impairment. What David challenged me to do was to start doing MRI scans in 2-year-olds with autism. And if you know anything about MRI scans, they are not particularly conducive to having a 2-year-old lie super still in a tube while there's loud banging noises going on. And so we developed methods to scan kids during natural sleep. So we started scanning 2-year-olds. We would do all of our scans at night when we would wait for them to fall asleep, and then we would stick them in the scanner and, take pictures of their brain, take them out, hopefully they're still asleep, and send them home. So we've been doing this now for almost 20 years. We've scanned over 500 kids during natural sleep without using any sedation or anesthesia. So getting to this memorable or impactful experience, I think the most impactful thing in my research career has been spending the hours waiting for kids, autistic kids, to fall asleep with their parents and hearing their stories and their journeys and what their lives are like. Because, when it's like midnight at an imaging center and you're all by yourselves, people let their guard down and you have conversations with people that you wouldn't necessarily have in like a daytime research setting, right? When we're trying to do diagnoses and behavioral assessments. And these nighttime scans, when I could sit and talk to the parents and really hear them and feel what their journeys were like, those conversations have been the most impactful in inspiring me to work harder to try to understand autism. And then I'll say, the other thing about the Autism Phenome Project is that it's a longitudinal study. And so these 2-year-olds that we recruited in 2006, we are now bringing back as young adults. So they're now 20, 21 years of age, and we've seen them at multiple time points across childhood. And so getting to see these kids actually as they grow up through their journey is also incredibly meaningful and impactful because kids change, kids grow up, right? And being able to follow that same child and same family across time is an absolute privilege and so impactful to me as a researcher.
Your research primarily focuses on the neural mechanisms underlying autism spectrum disorders. If you could elaborate on how you approach that very complex subject.
So for those, MRI is uh, used clinically, but it's the only way that we can study the brain in living people. And we can repeat MRI scans so we can look at the brain as it's developing across time. And so that's the general method that we use to approach this topic. But I think the longitudinal component is really, really important. So we've seen these kids now at up to 5 time points so we see them when they first come in around 2 to 3, and then we actually take pictures of their brain at annual intervals for the first 3 study visits because we know brain development is very, very rapid and dynamic under the age of 6. So by the time you're 6 years of age, your brain is already 90% of the volume of your adult, and it's developing really. I mean, if you look at a preschool aged child, what they can do when they're 2 versus what they can do when they're 5 is very different, right? So that's we're trying to look at the brain during that time period. But then we have another MRI scan that we do around 9 to 11 years of age in middle childhood. And then we go all the way out to adolescence to 15 to 18 years of age. And looking at brain development across this time as their behavior is also changing and developing, I think is really critical. And it's very, very complicated. But it's, I think, the most impactful way to study the brain. In studying the brain, and we're trying to understand the neural mechanisms of autism, we have to make sure we're studying everybody with autism, right? And so, again, like historically, a lot of the studies have been in older people, so people who are very compliant and able to go into a scanner. But young children is something that we were really passionate about and looking at, but also including, and you said this a little bit in my introduction, 40% of individuals with autism have an intellectual disability, meaning their IQs are below 70. A lot of those individuals are not included in neuroimaging research because there's this idea that you can't just tell them, they need more supports to go through an MRI scan. And so when we're studying the neural mechanisms of autism, I feel very, very passionate that we have to be including everybody, including the nonverbal, non-speaking kids, people with intellectual disability, all the way up to people with IQs of 150. The other thing we have to do is include both males and females with autism. So you talked a little bit about the GAIN study, the study that's focused on girls. So we know that autism is diagnosed at about 4 times as many boys as girls. And that imbalance is reflected in our research studies. So we actually know very little about the brain and brain development in autistic girls and how it might be similar or different from autistic boys. And so the GAIN study was really developed to bring in more girls into our research, autistic girls into our research program, so that we could start to look at those sex differences. So we have to study everybody multiple times. That's the bottom line. And that makes it very hard and very complicated.
Could you talk about the specific neuroimaging techniques you use in your studies, such as MRI and fMRI, and how they help in identifying differences in brain structure in individuals with autism?
Yeah, um, so we use several different types of MRI scans to study the brain, and each one tells us something different about brain structure or function. And so let me just walk you through the different pictures that we take. Um, our workhorse image is called a structural MRI image, and it's basically a neuroanatomical scan. So it gives you brain structure. And with that scan, we can do all sorts of things related to measuring how big things are, how fast they're changing, how fast they're growing. We can look at the folding patterns of the cortex to look at how those might differ. So really it's a morphometry. So looking at anything related to shape and size of the brain. That's your structural MRI. There's another type of MRI sequence called a diffusion weighted sequence. That's a separate picture of the brain. And what that sequence is giving us is information about the white matter pathways in the brain. And so specifically, it's a way of looking at brain connectivity, but it's looking at the anatomical connectivity in the brain. And then there's also something called functional MRI or fMRI, which many of you have likely heard of. There's two different ways to use fMRI, that we use fMRI. One, I think, is sort of traditionally what you've maybe heard of, where you do something and your brain lights up, and that tells you what parts of your brain are active. We call that task-based fMRI. So that's like you put somebody in the scanner and you make them do a memory task, and you look for the regions of the brain that light up, the hippocampus, the medial temporal areas. That's the type of scan I used to do in grad school. In 2-year-olds with autism who are asleep, you can't ask them to do a task. And so we do a type of scan called resting state functional connectivity. And so this is the brain is always active, even at rest. And there are networks that are active at rest. There are some networks that are more active at rest than during active wakefulness. And so we also collect this resting state functional MRI just to look at brain activity at rest. And those are the different ways that we study the brain using MRI.
One of your studies highlighted differences in brain connectivity in young children with autism. Can you please discuss these findings in detail and their implications?
Yeah, so actually several of our studies have looked at brain connectivity in different ways in young kids with autism. And I mean, I think what we're hoping is if we can understand the big picture of what we're doing is if we can understand how the brain is getting wired differently in kids with autism, then we can better understand where they're coming from and potentially develop interventions that target those differences. Um, but to get to the specific questions, we've had several studies using this diffusion weighted imaging sequence that I talked about to look at the corpus callosum in the brain. So this is structural connectivity. The corpus callosum is the largest fiber bundle in the brain. It connects the left hemisphere to the right hemisphere. And here we've found very interesting differences between boys and girls with autism in their corpus callosum, where the fibers are projecting to, as well as the diffusion properties of the corpus callosum alone. And this was really our first foray into really seeing that there are neurobiological differences between autistic girls and autistic boys. And I think the implications of starting to try to understand these sex differences in autism is, first of all, just to recognize that there are different underlying neurobiologies that can lead to the same behavioral presentation. And that can get us, maybe there are different causes and etiologies that we should be focusing on. So really recognizing that girls might be different from boys. We've also done a lot of work focused on a region of the brain called the amygdala. And the amygdala is a subcortical structure that's involved in threat detection and regulation of emotions related to fear. And so one way I think about the amygdala, because autism is not necessarily related to fear, but what I have told parents in the past, the way I think about this sort of big picture conceptually, is if you have a structure like the amygdala that's really involved in threat detection, so it's telling you what in your environment should you avoid? Should you, what in your environment will eat you, will hurt you in some way? And there have been studies implicating the growth of the amygdala in autism, that it's growing too quickly, that it's enlarged, that it's bigger in kids with autism compared to kids without autism. And the way I think about this is if you have a structure of the brain like the amygdala that's so involved in something as basic and primal as threat detection, and it's growing and it's reaching out and it's trying to connect with other parts of the brain, like the frontal lobes, that are going to help interpret those signals and generate responses to those threat signals. If the amygdala is growing more rapidly than other parts of the brain and it's trying to send out connections to talk to those other parts of the brain, but those other parts of the brain aren't yet mature enough to receive those connections, you can think about then how the whole organization of the brain could be developing differently, right? And so that's a lot of what we're trying to understand in these longitudinal studies is how these networks might be set up a little bit differently. And the rate of development of one structure can throw off, the development of this network. And then how can we get that network back on track? And so in that way, we can think about the amygdala in terms of social cognition. If you can't really determine in your environment what should be threatening or you should be fearful of, that can also alter your social behaviors, right? So the amygdala is involved in anxiety, outside of autism, but also within autism. So that's been a big focus of our area, and we've published several papers looking at both structural and functional connectivity of the amygdala and how it's different in people with autism.
In the studies you did they also show that the amygdala was larger than in comparison to like, you know, neurotypical children, I guess?
Yeah. Yeah, so in one of the studies that we did, we looked specifically at the size of the amygdala when kids were 3 years of age. And given that I know that the amygdala is involved in things like anxiety as well, I had the hypothesis that maybe the amygdala is enlarged in only a subset of kids with autism. So getting back to the whole goal of the Autism Phenome Project, which is to parse out different subtypes of autism. And so the hypothesis I had was that maybe the amygdala is enlarged in kids who are more prone to have anxiety. And these are 3-year-olds, so they're not going to be clinically diagnosed with anxiety yet, but they can show anxiety symptoms. And that indeed was the case. We showed this in one paper that the amygdala enlargement was really being driven by this group of kids who also had high anxiety symptoms. And I think that's really critical, getting back to this idea that we can't think that every person with autism is going to have the same underlying neurobiology. And so in this subset of kids, maybe the amygdala is a marker for co-occurring anxiety in autism. So we have another study that we followed up on where we actually looked at amygdala development from age 3 all the way up to age 12. And we found different patterns of amygdala growth and development based on those autistic kids who were at age 12 diagnosed with a clinical anxiety disorder. And so even at age 3, the size of the amygdala is predicting what the child's going to look like at age 12. And so again, the idea is if we can use the brain to try to identify and predict the outcomes, then maybe we can intervene and try um, to alter brain development in some way. I keep saying that, but I do want to say that that is a ways off. That is that is what your generation maybe will do, because I think we have a lot of work to do in figuring out how the brain is related to future outcomes first.
During your research, you must have come across surprising or significant findings of brain development in individuals with autism. Um, what do you think those were, and how do you think that has contributed to the understanding of the neurobiological basis of autism?
Yeah, this is a great question, and I have so many answers for this, but I will try to contain it. Um, so to three. So I'm going to say three things. First, I think one of the most surprising findings is as we were starting to collect all of these MRI scans, one of the most surprising things I think I'll just say, and what I say to a lot of parents, is that if you look at an MRI scan of an autistic child next to a child in our neurotypical group, by the naked eye, you can't see a difference, right? There is nothing like obviously different about the MRI scan of a child with autism. And so that to me signifies that, so this is in contrast to something like Alzheimer's disease or neurodegeneration, where there are basically parts of the brain that have that are gone, so that have degenerated. So I think that this is really hopeful because it tells me that all of the brain structures and the brain networks are there. It's really just about fine-tuning and tweaking things. The differences are going to be much, much more subtle in an autistic person versus a non-autistic person than in somebody with Alzheimer's without Alzheimer's. And so this idea that that you're going to see autism in the brain is really is not there, at least at this gross sort of macro level. Having said that, though, we have had some surprising and significant findings related to the neurobiological basis of autism, and I'll tell you about one that is my favorite finding that we have. And this is a finding of, this is actually a study that we did outside of the Autism Phenome Project. Here we were looking at babies. So we were looking with Sally Ozanoff here at the Mind Institute. She has an infant sibling study trying to prospectively look at autism as it emerges before you can diagnose a child at age 3. And so these are children, infants. So these are infants who have an older sibling already diagnosed with autism. And then we're following the baby sibling across their development and we know that a higher percentage of them will end up with a diagnosis of autism than the general population. So about 25% of younger siblings of people with autism will also have a diagnosis of autism. So they're a good group to try to study to look for early biomarkers. And so we started studying the brains of these infants at age 6 months. So we scanned them at 6 months, 12 months, 18 months, and then they got a diagnostic evaluation at age 2 and 3 to see who ended up with autism, with a diagnosis of autism, and then we could look early on at early brain predictors. And so we had this finding of what we call increased extraaxial fluid around the dorsal convexities of the brain. So basically, you have cerebrospinal fluid in your brain, and everybody thinks about it as this like shock absorber of the brain. You know, it sort of like buffers your brain and protects your brain. But emerging, there's just this whole field now that is starting to understand that CSF, cerebrospinal fluid, does much more than just serve as a shock absorber. It's actually very actively taking away waste products of the brain because your brain is very metabolically active. And so there are a lot of waste products that need to be washed out. CSF plays a large role in that. And we saw, getting back to the finding, that kids with autism, infants who eventually would be diagnosed with autism, had increased levels of this extraaxial fluid in their brain starting at 6 months. Previously, you know, radiologists have called this finding and called it benign and said that, you know, usually it resolves. So by the time a child is 2 months, 2 years of age, this extraaxial fluid is usually gone. But we were studying these kids longitudinally and found that the kids who had extraaxial fluid that persisted from 6 months to 24 months of age, and meaning that this extraaxial fluid wasn't really declining, going away at the rate that radiologists would expect, those were the kids who went on to get a diagnosis of autism. So this to me is really exciting because one, it could speak to potential mechanisms of how brain development might be altered in autism, and it's an early biomarker that could signify to a family, you know, I should pay more attention to my child's development so that I can intervene earlier with behavioral interventions that we have.
Thank you. I learned a lot from that answer. And could you also discuss any recent technological advancements in neuroimaging that have significantly impacted your research?
Yeah, so I mean, building off of that prior answer, there are new sequences looking specifically at CSF flow that I think would be very interesting. So we were just looking at the volume using our structural scans, the volume of extraaxial fluid. But really what we want to get at is what is that CSF doing? Is it stagnant? Is it flowing? Is it, you know, so getting more at what that CSF is doing could answer questions about the mechanism. So that's research we haven't done yet. Those are technological advancements that MR physicists are working on that I'm very interested in. Another technological advancement in imaging, I think, is that there are more sequences being developed out there and methods to deal with motion in scans. And so I didn't talk about this much, but in MRI scans, it's a great method. but it's very, very sensitive to motion. So if you're lying in the scanner and you move at all, I mean, I'm talking like millimeters of movement, that can degrade the quality of the scan. So it's just like when you're taking a picture of someone and there's movement and it's blurry, it's that times 100 in an MRI scan. And so motion has been a huge, huge limitation because you put kids, wiggly people, anybody, put me in the scanner, I'm going to move a little bit. As soon as you like tell yourself not to move, you start really wanting to move. At least that's how I am in the scanner. And so a lot of the scans that we take, particularly in people with higher support needs, maybe have more motion in the scans. And now there are ways to acquire sequences to deal with that and to get rid of the impacts of motion in the scans. And I think that will really open up a lot in the field and allow us to be studying more people with autism. Because we don't want to just study the people who are compliant and able to lie still in the scanner.
Thank you. And I had one thing I was kind of curious about with because it's already so hard to like do the scans with um young children, but like with the infants, how were the scans possible? Because I at least I imagine they'd wake up from all the noise.
Yeah, so infants are actually pretty easy to scan, probably easier than 3-year-olds, I would say, because you just feed them, you wrap them up, and you stick them in the scanner. I mean, infants sleep a lot anyways, and there's actually there's a whole infant, outside of autism, a whole infant development MRI field where people are using MRI to look at brain development during infancy. Where it really drops off is in that 2 to 3-year-old age range. That's where it gets harder to scan kids during sleep. And that's where we've come in with our protocols. Um, Shockingly, kids can sleep through a lot more than you think. And this is something I've told parents, and my daughter is in the study as well. And so I've scanned her. And after I scanned her, I was like, wow, I don't have to be as quiet around the house as I thought I did. Because toddlers, they play hard and they crash hard, and you can actually do a lot more with them, most of them, than you think. So that was.
Another surprising thing, I guess. How do you envision the findings from your research being translated into clinical practice? Um, like mind. Are there any specific interventions or diagnostics you are particularly excited about?
Yeah. So, this is a question that I struggle with all the time because I got into this field because I'm interested in the brain and I'm interested in knowing the underlying neurobiology. But how is that actually going to translate to anything impactful in a child's life, right? How does that translate to clinical practice? And I've talked a lot about using early brain or brain to predict outcomes or identifying the neural circuits to target interventions at. And I do believe all of those things, but I think we're still a ways off from doing those sorts of things. Um, I think the fundamental questions are what can the brain tell us that behavior alone can't tell us? And I think some of the studies that we've done suggest that there are different underlying neurobiologies that can lead to similar outward behaviors. And I think those are important to understand. I think from a basic science knowledge, that makes a lot of sense to me. How that specifically is going to translate to clinical practice, I think is further off, but I think it's still important to do. And if we understand the neural basis, that opens doors to future research, to other research that can develop these interventions or diagnostic predictors or things like that I'm hopeful for. So I'm going to keep doing it, but I would just say to folks that the answers don't all lie in the brain. I don't think it's going to be the brain in combination with other fields that's really going to lead to clinical impact.
What advice would you give to young researchers who are interested in pursuing a career in neuroscience or autism research?
So I think I've been thinking a lot about this question. And a couple things. One thing I would say to maybe someone like you is explore all your options, right? So um, don't just go to graduate school because because you don't know what else is out there to do. I think that's something, that a lot of us are good at school. We're really, really good at school. And so we keep going to school, and we keep doing research. But there are lots of other options out there. And so when people come and work in my lab, I love that they're here at the Mind Institute because they get to interact with clinical psychologists, with pediatricians, with social workers, there's lots of different ways to make an impact in autism research and in neuroscience research. Um, Maybe less in neuroscience than autism. But if you're really passionate about the brain and neuroscience, I think in addition to taking the coursework in it, then I think you should do what you're doing, which is actually interact with the population that you're interested in. And so interacting with autistic kids, with families of individuals with autism is going to inform your research, inform your questions, and really motivate you. So those are sort of the things that I would recommend.
Thank you for the great advice. What are your hopes for future autism research and the broader field of neuroscience?
So I think a lot has changed in the 20 years since I got into doing autism research. And I think a lot of it has been in um, public perceptions of autism. And so there really has been a shift away from thinking about autism as a disorder that needs to be treated, to a disability or a difference. And I think that for me, having more involvement from autistic researchers is really exciting for the field. But I do want to caution that we don't just want to involve autistic researchers who are cognitively and physically able to work in our research labs. We also want to represent autistic kids who aren't able to do those things, right? So autistic kids with higher support needs, with intellectual disability. I would like to involve their caretakers and stakeholders in our research programs as well to really understand what their needs are, and to make sure our research is targeting their needs. And then the other thing, I guess, would be this inclusive approach. So studying everybody with autism, I think, is really important. But really involving more autistic researchers and their caretakers in our research programs, I think, is shifting, and that's my hope. And my hope is that we can all continue to get along, and remember what the big picture mission is, which is to help and have an impact in the lives of people with autism.
Dr. Nordahl, thank you so much for this wonderful conversation, and congratulations on all the amazing success you've had, and I hope for continued success.
Thank you. I
Yeah,
really enjoyed chatting with you today.
thank you.